Okay, Lisa. We have Lisa here. We're going to do some filler today. Lisa has a facial nerve injury that's been for quite a while, and we've done some different Botox and fillers for her. But today, we're going to put some filler in the nasolabial folds to soften them up a little bit. And this filler is Juvederm. This is a hyaluronic acid filler, and it works very well for filling in lines and wrinkles and kind of depressions in the face. So it's a very small needle. Sometimes we'll use a numbing medication. Sometimes we just use no numbing medicine. This has a topical, or this has some lidocaine in it. So the needle just goes right here in the fold, and I just kind of slowly place it in the subcutaneous space, and it will just start to soften up that fold. And it's really good for really all ages, anybody that has a deep nasolabial fold. These tend to get stronger or more prominent with time. So Lisa, how much does that hurt?
It doesn't.
It's pretty minimal.
It's really minimal, yeah.
You can feel it. It is a little poke,
yeah,
but
that's all.
You know, she's somebody that doesn't even need the topical because it doesn't really hurt her that much. So now we can kind of, you know, we've done a little bit of filler on both sides here, and we can see that this side, the nasolabial fold, is a lot softer now than this side is because we've softened that up with the filler, and it really is very effective for this area and other areas of the face. Now I'm also going to put some down here at the corner of the mouth because it has the effect of helping to turn the corner of the mouth up a little bit. And it also fills in depressions. Hers aren't very deep here, but she has a start of a little bit of a depression here at the corner of the mouth. And it depends on how deep the fold is, how much we need. I can cover all four of these areas with one syringe for Lisa because hers aren't, exceptionally deep. She's kind of the ideal candidate for filler, I would say. Okay, now just relax. And you can just see this side is a lot softer. You can see the little poke marks from where I put the needle, but I think she probably won't get any bruising from this. I usually have her take an ice pack and just put it up here to hold a little bit of, to keep the bruising down there. So we'll have you hold that there, Lisa. And I'll go around to the other side now. Filler is very safe. It's been around for several decades now, and there are different types of filler. These hyaluronic acids have kind of become the mainstay of treatment because they're so safe. There is minimal risk of infection or other complications with them. And unlike all the other fillers, the HA fillers can actually be dissolved if there's a problem and you need to go and get rid of it. They're actually reversible, and so that makes them even more appealing because if there's some kind of a problem, then it's easy to deal with. Now we can see this nasolabial fold on the left side is much softer than it was before, and the two sides are very similar now. This is the side that she has some weakness on, but she still has good tone there, and those two sides are both a lot softer now. And I'll put some down here in the corner of your mouth. This type of filler can last anywhere between 4 months and a year. It just depends. Some people break it down more quickly than others, but for most people, we get about 6 months out of it, I would say, and it holds pretty well. It also has been shown to stimulate collagen after repeated injections, and so that's one of the other benefits of filler injections. Now you can see after this one syringe of filler, which I treated really 4 areas with, her face is just softer around the mouth. She doesn't have those deep lines anymore. These are softer here, and there's no downtime. We'll just have her hold the ice on there, and probably no bruising, I would guess, on this one. And she did great. Minimal pain, right?
Totally minimal pain. Yep.
Good job. Okay, why don't you get that ice up there?